Welcome to our NREMT review series. These videos are intended to help prepare you for taking the NREMT exam at all levels. In this review, we will give a brief overview of the autonomic nervous system. We will break the video down into three main sections: overview, definitions, and understanding. Why you will need to know this at each provider level. We will get into some pharmacology. We will start with medications that begin at the EMR and the EMT level and progress up to the paramedic level. Now let's begin this journey. The autonomic nervous system, ANS, is responsible for regulating involuntary bodily functions like heart rate, digestion, respiratory rate, and more. It's divided into two main branches: the sympathetic nervous system, SNS, and the parasympathetic nervous system, PNS. Sympathetic nervous system, SNS. Function: activates the body's fight or flight response, preparing it for stressful or emergency situations. Neurotransmitter: primarily uses norepinephrine, also known as noradrenaline, to transmit signals. Alpha-1 receptors: these receptors are found in various organs and tissues. Activation of alpha-1 receptors causes blood vessels to constrict, increasing blood pressure. Beta-1 receptors, predominantly located in the heart. Stimulation of beta-1 receptors increases heart rate and the force of contraction. Beta-2 receptors, located in the lungs, blood vessels, and some other tissues. Activation of beta-2 receptors causes relaxation of smooth muscles in the airways, bronchodilation, and blood vessels, vasodilation. Parasympathetic nervous system, PNS. Function: responsible for the body's rest and digest response, promoting relaxation and conservation of energy. Neurotransmitter uses primarily acetylcholine to transmit signals. Acetylcholine acts on various receptors, including muscarinic receptors found in organs like the heart, smooth muscles, and glands, promoting activities that conserve energy and facilitate digestion. Let's identify why you need to know this. In emergency medical services, EMS, the administration of medications is a critical aspect of our practice. While dosages might vary slightly based on specific protocols, grasping the rationale behind the use of each medication and its timing is paramount. It's crucial to comprehend not just how much medication to give, but why and when to administer it. Comprehensive knowledge about the expected effects of each medication is vital. This understanding ensures that when the medication is administered, we anticipate and are prepared for the resulting physiological changes. Ultimately, the depth of our knowledge and readiness in medication administration can directly impact someone's survival in an emergency situation. Being fully informed and aware of the medications we administer is not just a responsibility, but a lifeline. Someone's life may hinge on the depth of our understanding and preparedness. Here are the medications that affect the autonomic nervous system. Albuterol, EMT level. Medication type: it's a beta-2 adrenergic agonist. Effect on the autonomic nervous system: Albuterol primarily targets beta-2 receptors in the lungs. When administered, it causes bronchodilation by stimulating these receptors in the smooth muscles of the airways. This action aids in opening up the air passages, making breathing easier, and relieving symptoms of conditions like asthma or COPD, chronic obstructive pulmonary disease. Atrovent, ipratropium, EMT level. Medication type: it's an anticholinergic bronchodilator. Effect on the autonomic nervous system: Atrovent works by blocking muscarinic receptors in the airways. By inhibiting acetylcholine's action on these receptors, Atrovent causes bronchodilation and stops the production of mucus. It helps relax and widen the air passages, facilitating easier breathing in conditions like COPD. Epinephrine, EMT level for anaphylaxis, paramedic level for cardiac arrest. Medication type: it's a hormone and neurotransmitter, and in medication form, a medication known as a sympathomimetic. Effect on the autonomic nervous system: epinephrine acts as a potent activator of adrenergic receptors, including both alpha and beta receptors. Alpha-1, beta-1, and beta-2. Its effects mimic those of the sympathetic nervous system. When administered, epinephrine increases heart rate, dilates airways, redirects blood flow to muscles, and prepares the body for immediate action. It's used in emergencies like severe allergic reactions, anaphylaxis, cardiac arrest, or acute asthma attacks. Norepinephrine, paramedic level. Medication type: it's a neurotransmitter, and in medication form, a medication known as a sympathomimetic. Effect on the autonomic nervous system: norepinephrine is a neurotransmitter primarily employed by the sympathetic nervous system. In medication form, it's used to increase blood pressure in critical situations like septic shock or certain types of hypotension. Norepinephrine acts mainly on alpha receptors, causing vasoconstriction and thereby elevating blood pressure. Atropine, paramedic level. Medication type: it's an anticholinergic. Effect on the autonomic nervous system: Atropine blocks muscarinic receptors throughout the body, effectively inhibiting the actions of acetylcholine. This inhibition results in various effects, including increased heart rate, by blocking the parasympathetic influence on the heart, dilation of pupils, mydriasis, reduction of salivation, and relaxation of smooth muscles in the digestive tract. Atropine is often used in medical settings to increase heart rate in emergency situations, as well as to slow down the effects of organophosphate poisoning. Dopamine, paramedic level. Medication type. Dopamine acts as both a neurotransmitter and a medication used in emergency medicine. Effect on the autonomic nervous system. Dopamine, when administered intravenously in a medical setting, impacts various receptors at different dosages. At lower doses, it primarily affects dopamine receptors, leading to the dilation of blood vessels in the kidneys and certain other organs. At moderate doses, it stimulates beta-1 receptors, increasing heart rate and improving cardiac output. At higher doses, it primarily activates alpha receptors, causing vasoconstriction, which can raise blood pressure. I hope this video offers valuable insights into comprehending the autonomic nervous system's workings. It underscores the significance of our grasp on patient anatomy and physiology as EMS professionals. Understanding these fundamental aspects is crucial for delivering optimal care and making informed decisions when managing our patients' needs. Oh yeah, and passing the National Registry exam. Please like, subscribe, and share this information if it was helpful to you.